So one of the biggest questions I feel like I receive is, how do I know I'm in labor? When do I call my doctor? When do I go to the hospital? Things like that. So that's a very big fear. I think it gives moms a lot of anxiety. So I'm just going to talk a little bit about when you should call your medical provider and why you should kind of wait and do that. So you want to make sure that your body is actually in labor and you're having contractions, and it's really easy for you to just want to call your medical provider right away, go to the hospital to see if it's the real deal. But it is important to wait and make sure that your contractions are 5 minutes apart, 1 minute in length, and that happens for 1 hour. That happens for at least 1 hour. Um, if you call your doctor, it's very hard for them to determine, if it is actually active labor, and what's going on. So they might encourage you. Well, the only way we're going to know is if you go to the hospital and get checked, and we can kind of gauge where you're at and what dilation you're at and things like that. There is a possibility of getting sent home if you do that. So what I encourage you to do is make sure that you are following that rule, 511. And once you are at that point, then you can call your medical care provider. If you call them anytime before that and you're just laboring at home, or maybe you're going through some pre-labor type things, there's not really much they can do about it, and you're not going to be going to the hospital right away. So definitely call them before you're going to the hospital, because that way they know, okay, it is the real deal. Hey, we're going in, things like that. A lot of times, you could also wait till your contractions are 4 minutes apart. I know some people follow that rule as well. So call your doctor whenever your contractions are that long, so that way they know, okay, they're in active labor. We're all gonna head to the hospital.